Hi everyone, welcome again to Autism 101, the place where you receive valuable and beneficial information for your aid. All right, so what are we talking about today? We are speaking about speech delays, speech difficulties, speech challenges. All right, so we all know that there are several speech problems, all right? And the common ones are slowness in learning to talk, right? Stammering or stuttering, difficulties in speaking words clearly. Speaking words clearly. Now, if by age 5, if your child has not begun to utter his or her first word, right? Or to have a one word sentence, or you wouldn't really call that one word sentence, but one word, even a echolay word, right? If your child does not have that whatsoever by age 5, then that is considered to be a severe disability. If they have a one word, two word, then that is moderate, right? So what to do in this case? First of all, for slowness in learning to talk, test the child hearing. Test the child's hearing. Okay, because it could be a possibility that there's a hearing problem, right? So that is the first thing that they usually recommend, an hearing test, right? Be mindful though that in boys takes longer to develop. So sometimes boys take longer to speak, right? So that is something to consider as well. And of course, the other tip is sensitization to an environment filled with communication. Whether you want to tag your entire home, right, with tagging the furnitures that you have in your home, dresser, refrigerator, television, whatever it is, so that you can sensitize a child to language and communication, the way in which you communicate with others around you. And it would be good to have children around you. But if there are no other children around you and it's just your one child, then be reminded that you yourself, you can make it fun, to have a fun environment, bubbly around your child, to always communicate with your child, right? Another thing is that with stammering, remember that that could also be a self-taught skill. I wouldn't even call it a skill, but it's usually an habit that the child develops, right? So you will go through a process of unlearn to learn again. But what we recommend though is that you visit your child's doctor or your child's pediatrician or an early intervention program of yours, or a speech therapist, any one of those specialists, to find out what exactly is happening. Take your child also for an assessment to know if the child is on the autism spectrum disorder, or so that you will have a knowledge to know if there is any form of special needs with your child. What exactly is causing that speech delay? All right, so this is tip 101, Autism 101. Join me again tomorrow. Bless you.